Thank you, Dr. Fox, and thank you, Mr. Speaker. I urge my colleagues to join me in opposing H.R. 3. While we can all agree that Americans pay too much for health care and that the rising cost of prescription medicine needs to be addressed, H.R. 3 is not the bill to accomplish those goals. Traveling across Pennsylvania's 12th Congressional District, I have met with patients and medical professionals who have told me that the best way to address rising prescription drug costs include patient reform that will include patent reform to get generics to market faster, price transparency so consumers know the actual cost of medication they are purchasing, and incentivizing innovation to help find new cures. Contrary to these goals, H.R. 3 would turn a blind eye to good bipartisan work done on this issue throughout 2019 that can provide real savings for our seniors and our families. H.R. 3 would lead to more government control over a private industry, putting this country on the road to socialized medicine. And H.R. 3 would lead to fewer cures, with some estimates saying up to 100 fewer cures would be found as a result of this legislation. Mr. Speaker, we have a bipartisan plan that has the support of doctors and patients alike. H.R. 19 would provide for more cures, create price transparency, and get generics to market faster. These are bipartisan solutions backed by doctors and pharmacists in Pennsylvania's 12th Congressional District, in the Commonwealth of Pennsylvania, and across our country. While Americans struggle to pay for high cost of prescription drugs, we have real legislation that can help solve this real problem. We should not be wasting our time debating something that harms Americans by providing fewer cures and will never become law. Again, I urge my colleagues to oppose the socialist fantasy in H.R. 3 and encourage us to work on the real bipartisan solutions in H.R. 19. Thank you, Mr. Speaker. I yield back.